Of the novel coronavirus in Kenya has left the country on unfamiliar ground. The Ministry of Health is spearheading a raft of precautionary measures, including encouraging members of the public who suspect of having been infected to self-quarantine for 14 days. But how practical is it to self-quarantine? The answer to that question is simple if you live in an area with ample space and decent housing. But as KTN's Timothy Otieno now reports, it's a much harder question to answer if you live in one of the many informal settlement areas in the country where poor sanitation and overcrowding is the order of the day.
Nairobi's vast Mukuru area is home to close to 10,000 people. And here, stories about the deadly coronavirus are narrated more for comic relief than the seriousness it perhaps deserves.
Ingekuwa ugonjwa iko wangechukua kitu inaitwa immediately. Ungeona hata magari mandagitali wanaingia kwa kijiji, wanaingia town.
But the virus is real and it's deadly. With global deaths surpassing the 5,600 mark, fatalities have been reported in more than 5 African countries, including Egypt, Sudan, Algeria, and Morocco. But for the residents of Fuatanyayo area in Mukuru, the threat is only imaginary, especially if the national government, in their eyes, remains lackluster in the manner they are handling the global crisis.
Hiyo ni uongo. Hawa natafuta vile watakula hiyo milioni 3, hiyo ilitengwa. Manake kungekuwa na hiyo koloni, kila mtu hapa angekuwa na maski. Kila mtu wa Kenya angekuwa na maski, hiyo tunaona inawekwa huko ng'ambo.
But not everyone is as skeptical. Julius Kiume is a trader in the area who believes containing the spread of the virus, especially if it gets to informal settlement areas, is a tough task.
Popote pale huko utaipata. Chochote unafanya unagusana na kila kitu. Kwa hivyo labda tusuiwe ama tuondolewe pesa tuseme haita circulate.
The virus can spread when one comes into contact with a contaminated item or object. It is advised that one ought to self-quarantine if they have symptoms of the virus, a task that may be hard to execute within Kenya's ever-crowded slum settlement areas.
Hii mambo ingine ya kusema watu wajifungie kwa nyumba, kulingana na mimi ama maoni yangu, naona isaidii. Kwa vile kulingana venye unajua, watu wengi ni wa kiwango ama mapato ya chini. Lazima waamuke kila asubuhi ndio utafutie familia yako. Ile jambo la maana ambalo wanafaa kufanya, na watafute venye wanaweza kuzuia hiyo ugonjwa isiendelee na kuenea.
Serikali kitu ya kwanza ingefanya, ingezuia hizo ndege, ingefunga airport. Nchi zingine zimefanya.
With so far only one case of the pandemic having been confirmed in the country, the government and healthcare agents remain on high alert over the best possible way of preventing further spread of the deadly COVID-19 virus. Timothy Otieno, KTN News.